Hey there, health enthusiasts. In today's video, we're diving deep into the world of iron supplements for men and how they can unlock optimal health and vitality. We'll be exploring the crucial role iron plays in our bodies, the risks associated with iron deficiency, and the key considerations when choosing and using iron supplements. By the end of this video, you'll be equipped with the knowledge and tools necessary to make informed decisions about your iron intake and supplementation needs. So let's get started. Iron is a vital mineral that's essential for various physiological processes in our bodies. It's a key component of hemoglobin, the protein in our red blood cells that transports oxygen from the lungs to the body's tissues. In a 2010 study published in the American Journal of Clinical Nutrition, Zhu and colleagues highlighted the importance of iron in oxygen transport and its role in supporting energy production and a robust immune system. But here's the thing. Many men may not be getting enough iron through their diet alone, which can lead to potential deficiencies and health consequences. That's where iron supplements come in, offering a convenient and effective way to ensure adequate iron intake. Now, let's talk about the recommended daily intake of iron for men. According to the National Health and Medical Research Council of Australia, the recommended dietary allowance for men aged 19 and older is 8 milligrams per day. However, it's important to keep in mind that this is set to meet the needs of the majority of healthy individuals, and some men may require higher or lower amounts depending on their unique circumstances. For our vegetarian and vegan friends out there, you may need to pay extra attention to your iron intake. The iron found in plant-based sources, known as non-haeme iron, is less bioavailable compared to the iron found in animal products, which is called haeme iron. In fact, the National Health and Medical Research Council suggests that the iron requirement for vegetarians is approximately 80% higher than for non-vegetarians. So, what are some good dietary sources of iron? Well, haeme iron can be found in animal-based sources like red meat, poultry, and fish. On the other hand, non-haeme iron is present in plant-based foods such as legumes, nuts, seeds, and fortified cereals. A 2010 study by Harrell and Egley in the American Journal of Clinical Nutrition delved into the differences between haeme and non-haeme iron and their bioavailability. To enhance the absorption of non-haeme iron, a great tip is to consume foods rich in vitamin C alongside your iron-containing meals. Vitamin C acts as a powerful enhancer of iron absorption by converting ferric iron to the more soluble ferrous form. This was demonstrated in a 2004 study by Tucker and colleagues. So, don't forget to include plenty of citrus fruits, berries, kiwi, bell peppers, and leafy greens in your diet. Now let's talk about iron deficiency in men. It's a common nutritional disorder that occurs when the body's iron stores become depleted, leading to insufficient iron availability for normal physiological functions. In a 2016 study published in The Lancet, Lopez and colleagues explored the causes of iron deficiency, which can include inadequate dietary intake, impaired absorption, and increased iron loss. The symptoms of iron deficiency can be subtle at first, but may become more pronounced as the deficiency progresses. Common signs include fatigue, weakness, pale skin, headaches, and difficulty concentrating. In severe cases, iron deficiency can lead to anemia, a condition characterized by a reduced number of red blood cells and decreased oxygen carrying capacity. This was highlighted in a 2015 study by Camashella. Certain factors can increase a man's risk of developing iron deficiency. For example, vegetarian or vegan diets, intense physical activity, gastrointestinal disorders, and chronic blood loss can all contribute to depleted iron stores. These risk factors were explored in various studies, including a 2003 study by Hunt, a 2008 study by Peeling and colleagues, a 2013 study by Stein and Dignas, and a 2018 study by Kiss and Vassallo. So, what can you do if you suspect you have an iron deficiency or your dietary intake is insufficient? This is where iron supplementation comes into play. However, it's crucial to consult with a healthcare professional before starting any supplement regimen to assess your individual needs and potential risks. When choosing an iron supplement, you'll come across various forms like ferrous sulfate, ferrous gluconate, and ferrous fumarate. Ferrous sulfate is the most common and economical option, but some men may experience gastrointestinal side effects, such as constipation, nausea, or abdominal discomfort. A 2013 study by Cancelo Hidalgo and colleagues explored these side effects. In these cases, alternative forms like ferrous gluconate or iron bisglycinate may be better tolerated. It's also essential to consider the elemental iron content when selecting a supplement. This refers to the amount of actual iron in the supplement, which can vary depending on the type of iron salt used. For instance, ferrous sulfate contains 20% elemental iron, while ferrous gluconate contains 12% elemental iron, according to the National Institutes of Health. The recommended dosage of iron supplements depends on the severity of the deficiency and individual factors. Generally, a daily dose of 30 to 60 milligrams of elemental iron is sufficient for treating mild to moderate iron deficiency in men, as noted in a 2012 study by Santiago. To optimize absorption, it's best to take iron supplements on an empty stomach, either 1 hour before or 2 hours after meals. If gastrointestinal side effects occur, taking the supplement with a small amount of food may help alleviate the symptoms. Splitting the dose throughout the day can also improve tolerability, as suggested in a 2017 study by Stoffel and colleagues. It's important to be aware of potential side effects and interactions when taking iron supplements. Gastrointestinal disturbances are the most common, including constipation, nausea, diarrhea, and dark stools. A 2015 study by Tolkien and colleagues explored these side effects and suggested that increasing water and fiber intake or using a stool softener may be helpful. Iron supplements can also interact with certain medications, reducing their effectiveness or increasing the risk of adverse effects. For example, iron can interfere with the absorption of antibiotics, levothyroxine and levodopa, as noted in a 2014 study by Lim and colleagues. That's why it's crucial to inform your healthcare providers about all the medications and supplements you're taking to avoid potential interactions. Regular monitoring of iron status through blood tests is essential when taking iron supplements. Hemoglobin, hematocrit, and serum ferritin levels are commonly used markers to assess iron stores and the effectiveness of supplementation, as discussed in the 2010 study by Ju and colleagues. It's important to note that excessive iron supplementation can lead to iron overload, a condition that can cause organ damage, particularly to the liver. Hereditary hemochromatosis, a genetic disorder that causes increased iron absorption, can also result in iron overload, as highlighted in a 2016 study by Powell and colleagues. That's why it's crucial to follow the recommended dosage and duration of supplementation under the guidance of a healthcare professional. In conclusion, iron is a vital mineral that plays a crucial role in maintaining optimal health and well-being in men. Adequate iron intake is essential for proper oxygen transport, energy production, immune function, and cognitive performance. While a balanced diet rich in iron-containing foods is the foundation of preventing iron deficiency, some men may require iron supplementation to meet their individual needs. When considering iron supplements, it's important to consult with a healthcare professional to assess the need for supplementation, determine the appropriate dosage, and monitor potential side effects and interactions. By combining a nutritious diet with proper supplementation when necessary, men can ensure optimal iron levels and support their overall health and vitality. As with any dietary supplement, individual responses to iron supplementation may vary. It's essential to pay attention to your body's signals and work closely with healthcare providers to tailor the approach based on your personal circumstances and health status. By staying informed, proactive, and attentive to your iron needs, you can take charge of your well-being and unlock the full potential of this essential mineral. And that brings us to the end of today's video. We hope you found this information helpful and informative. If you want to learn more about iron supplements and other health-related topics, be sure to visit nutritionmarket.com.au. At Nutrition Market, we offer a wide range of high-quality supplements and have a virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get personalized advice tailored to your unique needs. Don't forget to hit the like button and subscribe to our channel for more content like this. Your support means the world to us. Before we go, it's important to remember that while the information in this video is informed by research, it should not replace advice from health professionals. Some scientific findings may still be under investigation, and it's always best to consult with your healthcare provider for personalized advice. Thanks for watching, and until next time, take care of yourself and prioritize your health and well-being.